Hi, welcome to Straight Talk. There is no issue bigger than the issue of opiate addiction and what's happening not only in Baltimore, the state of Maryland, but throughout this country. There isn't a neighborhood or city or state that is not suffering from this epidemic. It's killing over 60,000 people, 60,000 Americans every year dying of overdose. Well, we're very fortunate in Maryland. We have a governor who has come out with this issue 2 years ago almost, and has really led the effort, I think, throughout the country. And his main gentleman in charge, the Lieutenant Governor Boyd Rutherford, is here to join us. Thank you so much for being here.
Oh, thank you. Thank you for the opportunity.
I know you're very busy. It's a big issue, but I wanted you to spend some time letting the public know what are we doing? Because I think we're ahead of the rest of the country, but the issue is big.
It is a big issue. I mean, it's something that has troubled us since really when we were campaigning for office. That as we traveled around the state, it didn't matter if we were in a large city, Baltimore, or in a suburban community, or a small town on the Eastern Shore, we were hearing constantly heroin was the biggest issue that they were confronting. It didn't matter if it was the local, council person, or the sheriff, local sheriff, or the health officials. They were all talking about heroin as the big issue. So the governor decided, once elected, that he was going to convene a commission or a task force to try to come up with solutions to address this. We put together a task force, which he asked me to chair. We came up with a number of recommendations after talking to local officials and those who are in the treatment community, providing treatment, the local sheriffs, talking to people in recovery, as well as those who had lost those family members, who had lost other family members. And we came up with a number of suggestions and recommendations which we've been implementing. But as this whole crisis has evolved, we found that it wasn't enough. With the rise of fentanyl, the death rates were still going up. And so the governor declared earlier this year a state of emergency. And a number of people asked, why a state of emergency? And we said, well, when we had the unrest in Baltimore City, fortunately, no one lost their lives, but we declared a state of emergency. When we had floods in Ellicott City, unfortunately, 2 people lost their lives. We declared a state of emergency. Last year in Maryland, we lost 1,200 people, a little more than 1,200 people from heroin overdoses. When you combine that with alcohol and prescription medication overdoses, it goes close to 2,000 people in 1 year. So of course it's an emergency.
Sure is.
And what that allowed us to do is to work more closely with the local emergency response people on how we can start addressing this issue at the ground level, at the local level. And so we put more money into treatment. We're better coordinating in terms of our law enforcement, and not to go after the street dealer or the person who is really supporting their habit or their addiction, but to go after those who are trafficking this substance, bringing it into the communities. We've also been addressing the whole issue of prescription medications because a lot of our surge of new heroin users have come off of prescription medications. And so getting limitations on doctor prescriptions, or at least guidelines on that, is something that we were able to pass through legislation, as well as putting additional money into treatment and prevention programs. Because for the prevention side, we have to stop that pipeline of new users, because that's the demand aspect that's going on.
And that's what it is. It's a supply and demand.
Exactly.
And it's a vicious cycle that we've seen, but never seen anything like this.
No.
Heroin with fentanyl that is so deadly.
It is so powerful. This year, in the first 6 months of this year, as our statistics are starting to come in, we're seeing that overdoses that we can relate, fatal overdoses directly to heroin, are leveling off to the point and possibly coming down. Overdoses from prescription medications are coming down substantially, but overdoses associated with fentanyl are skyrocketing. And it is so powerful. It's 50 times more powerful than morphine, It's being either cut with heroin or people are taking it directly, and in many cases it's just killing people.
And a lot of families and a lot of people out there are suffering from addiction, and they want to know, how do I do, what I look for, and the general public says, well, if this drug is killing so many people, won't people just run away from it?
Yeah, but that's, as you know very well, that's thinking logically. That's not thinking like a person who's suffering from this disease. The person who's suffering from this disease of substance use addiction, they run to the powerful, the killer substance, because they say, hey, I need something more powerful than what I've been taking. And I'm chasing that next high, in a sense, the better high. And it's their sickness that's doing that. And so logically, it doesn't make sense to us who are not suffering.
Yeah,
but that
very,
is the
very
challenge.
True. Yeah, that's really true. Now, we've got a legislative session coming up.
Yes.
We've got, hopefully, with the president doing something at the federal level, maybe that will free up some dollars, do you think?
We're hopeful.
Yeah.
They did provide some funding last year, which passed through the states, and we were able to use that combined with what the governor put in our last budget to announce an additional $22 million in support for treatment and recovery services and prevention, as well as some law enforcement coordination. So we're hopeful there'll be additional money. We're also hopeful that they'll take a look at some of the restrictions that are in place with regard to information. And I know that a lot of the information protections are trying to protect people's privacy, but it makes it a challenge for us to be able to get to that person who may be in need of services. And I'll give the example. We're able to get information now that may show that a person has overdosed several times in the last month or 6 weeks, and they survived. But we know if we can't get that information, let's say to our social workers, that person is going to eventually die.
We'll keep using
if they don't get help, they're going to die. So we've been working with the Attorney General's office, trying to get guidance in terms of how we can use the data that we're able to get from various sources and provide it to, example being our social workers that can get that information or get to that person.
Look, you got us started here. We're excited. We're so proud that we're doing so much, but we also know that there's so much left to do.
Yes.
But I think we feel reassured now knowing that the governor and you, Lieutenant Governor, we're working on it. We're not forgetting about it.
No,
and I think that's the most
absolutely not.
important thing. So thank you so much. It was great having you on the show, get us started on this issue. We're going to keep talking about it.
Thank you.
And make sure the public is aware. Thanks for being on.
Thank you. Glad to be here.
When we come back to Straight Talk, we're going to continue talking about this opiate epidemic, and hopefully it'll help you or someone that you care about. So stay with us. We're coming right back to Straight Talk.
Who helps a hero? Who tells the story of their scars? The freedom and safety of so many, of us all, is earned by the sacrifices of so few. Who helps a hero? We all do. The Gary Sinise Foundation works to support America's defenders and strengthen their families through entertainment, the construction of smart homes for our wounded heroes, and by inspiring and educating others to also support the veterans within their own communities. We enjoy the benefits of their sacrifice and service each day. Now it's time we serve them. Find out how you can help our heroes at GarySiniseFoundation.org. While we can never do enough to show our gratitude to our nation's defenders, we can always do a little more.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you're beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
Thanks.
Hi, welcome back to Straight Talk. I want to thank the Lieutenant Governor of the state of Maryland for giving us an idea of what a state can do to confront this heroin epidemic, because it's important that every state government gets involved. But the real war and the real battle is going to be won in the communities, in our local treatment centers and our local neighborhoods. And joining me now is Sam Bierman, who is the Executive Director of the Maryland Addiction Recovery Center, which is a real model program that, again, we want to see duplicated all over the country. So no matter where you're watching the show today, you're going to learn something not only about the problem, but how programming at the local level is what's important. Sam, thanks for being with us.
Thanks, Mike. A pleasure to be here.
We're taking a lot of time here. We're doing a whole show here on this heroin epidemic and how do we deal with it? How do we confront it? But I still don't think people really understand how bad and how big it is. You've been in the field a long time. I mean, how do you explain what's going on here?
Well, it definitely deserves a whole show at the very minimum, right? And what's going on here is we are facing the biggest health crisis of our generation. And this epidemic is literally day by day wiping out an entire generation of our young adults currently. And so right now we are trying to work with local governments, treatment providers, the schools, all areas that this is impacting to really figure out the best ways to address this epidemic and get it under control.
Now, you know, we were talking in the first segment about 60-some thousand people in the country died of overdoses. That's more than car crashes, and that's unbelievable. And it's from this heroin with this fentanyl.
Yeah, I think they're estimating about 64,000 by the end of this year, which is going to be the most ever. And a lot of it is due to the heroin that is being distributed now on our streets is a lot different than what it was 10, 20, 30 years ago. And just what you said, Mike, it is being laced or mixed or cut with fentanyl, which is a very high-powered opiate, which can cause immediate death. And so that is why, one of the reasons why we are seeing such a high rate of overdose death these days is that the fentanyl that is being cut with this heroin is just way too strong for you know, human bodies to handle.
Now, we've had a heroin problem in the inner cities for 50 years. Now it's in the suburbs. How did it get to the suburbs?
Well, I think it's always been in the suburbs. I think it's much more in the public light now with the suburbs than it was in years past. But a big way that it really got out there is the prescription pill epidemic that has now turned into the heroin epidemic. And what happened in the suburbs is people were being prescribed illegally or getting off the street a lot of these prescription pills: hydrocodone, oxycodone, OxyContin, Percocet. And what people start to do is once they get hooked on these prescription pills, they build up a tolerance. And what happens when they build up a tolerance is the effect that they were getting when they first started taking the pills, they're not getting anymore. So then they start looking for something stronger and cheaper because prescriptions get very expensive. And the best thing that's stronger and cheaper is street heroin.
I mean, it's amazing to think that some middle-class businessman got prescribed drugs from a back surgery, and a month later he's out on the street looking for heroin.
Yeah, and it is that powerful, and addiction does not discriminate. So that middle-class businessman has just a likelihood of getting addicted as somebody in the inner cities that is growing up around it. Environment definitely plays a factor, but more than anything, there is a predisposition and genetic component to addiction that once you start, if you have it, you cannot stop. It doesn't matter who you are.
It takes over.
Takes over. Absolutely.
And so they end up doing this heroin, and heroin's bad enough. But when you get fentanyl hooked in with it, I mean, they're just dropping like flies. I mean, it's like every day.
Absolutely. I mean, it's just too strong. And people, when they're in that constant state of addiction, they think, their mind tricks them, and they think that they know what is safe to take, what is not safe to take, what the dosage that they can take for. The problem is with street heroin, especially the stuff that's laced with fentanyl, the potency of it is so strong that it doesn't matter even if you've been doing drugs for a while. Your tolerant levels don't matter. Your dependency levels don't matter. It's just too strong for the human body.
I mean, I literally read a story today in the New York papers where a mother, her son overdosed on fentanyl and heroin one day. She went in his room the next day to clean it up because it was all over the place. She was cleaning it up. It got in her skin. She overdosed and died.
Wow. From just touching it.
From touching it.
And that is how powerful it is. And I think there is a specific type of fentanyl that is much stronger than the medicine type of fentanyl that you may be talking about, which is called carfentanil, which is the type, if you touch it, it could seep in and kill you instantly.
It's unbelievable. It's absolutely, and we don't even, this epidemic, no one's talking about alcohol or marijuana or cocaine. I mean, this whole country has been focused on this opiate epidemic. And as the lieutenant governor was saying, at a state level, they're trying to get money, they're trying to build programs, they're trying to, the bottom line becomes what? Helping people, right?
Yeah, absolutely. I mean, we have to start helping people. And to retract a little bit, one of the main reasons this happened is when there were a number of healthcare organizations about 15, 20 years ago that made pain the fifth vital sign. And what started to happen is anytime a patient went into a doctor's office, went into a hospital, they were given a pain scale. And if they said that their pain was high enough, the doctors, the medical professionals, had to give them something to address the pain, and that would be an opiate. And so that's how a lot of this got started. But absolutely, we have to start focusing on helping these people.
But we learned, you're right, we've learned that we don't have to deal with pain, that there's something we can take, a liquid, a capsule, something we can make us feel good. And we see it on television, it tells us. I mean, people go to their doctors, I'm sure, and say, I want the one I saw on the Tonight Show.
Absolutely, and we are actually one of the only countries in the US that has direct-to-consumer marketing from pharmaceutical companies. So in a lot of other countries, and you go there, you don't see pharmaceuticals being sold to consumers on TV. You don't see it on billboards, but you see it in America all the time. And just like you said, people get in their head when they see that if you're feeling nauseous, if you're feeling pain, if you're feeling this, we have something for that. And that is the message that consumer America has received for a long time now.
Yeah. Well, you've got us started. We got a good overview. I want to come back and I want you to talk about treatment.
Absolutely.
Because I think that's what we're lacking right now. We need that much more. We're talking with Sam Bierman, Executive Director of the Maryland Addiction Recovery Center. We're talking about the nation's opiate problem. I don't care where you're watching, it affects your city. So stay with us. We're coming right back to Straight Talk.
Will spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving. The ultimate party foul.
There's one thing you can never have sex without.
It's not something you buy.
Or something you take.
In fact, there's only one way to get it.
It has to be given to you, freely.
It's consent.
Because sex without it isn't sex.
It's rape. Consent.
If you don't get it, you don't get it.
It's on us to stop sexual assault.
Learn how and take the pledge at itsonus.org.
Hi, welcome back to Straight Talk. We're talking about our nation's opiate epidemic, where it came from, what a state can do. We had the Lieutenant Governor of Maryland talk about the state. We're now talking with Sam Bierman, who is the director of the Maryland Addiction Recovery Center. He built a drug program to help people, and that's what we want to talk about. Sam, thanks for hanging in there.
Thanks again, Mike.
Let's talk. You've been there, you came back, you opened up a program to help people. Now, how do we help people with heroin problems?
So that's you have to take a multifaceted, very robust, comprehensive approach. And one of the main things to start with that you have to look at is the length that you need to help people coming off of heroin. Because the illness of addiction is so comprehensive, you need to have a lot of time. Professionals cannot treat this illness in any type of comprehensive way on a short-term matter. So one of the things we created at Maryland Addiction Recovery Center was we created a long-term treatment model on an outpatient basis as well as on a residential basis where people can come and live with us. When I say long-term, and this is what I tell the families that I speak to day in and day out, that they need to start preparing that their loved one is going to need at least 1 full year of some type of services. And usually what happens there is that it starts very intensely, and as that person progresses and starts to get a little better, the intensity dials down until they're fully back into society and being a productive member of society and not obsessing about drug use anymore.
And that environment, the fact that you can keep them for that length of time prevents them from going back into the same old neighborhood with the same old friends and the druggies, and it gives them a chance in a clean, drug-free environment.
Absolutely.
Which is different than we've done for 50 years with medications.
One of the oldest sayings in the treatment field is you have to change people, places, and things. Right. And so we can't send people back into the same environments where their addiction sprung up, where they continued their addictive process. We need to change everything, including their mindset, including their psyche. We need to look at absolutely everything. And so an environment is a very big one. The people they hang out with is a very big one. Their careers a lot of time is a very big one. Careers are a big cause of stress. They get in certain routines in certain careers. And so looking at their job, is their occupation conducive to their recovery or is it a barrier to their recovery? Schooling is another one. We want a big part of people in recovery is they need to have purpose. And so getting them back in the right schooling or in the right workforce, wherever they are professionally or academically, is a big motivating factor to continue on in recovery.
To keep them going. I know that you're very concerned about drug programs that are scams, that really aren't living up to high standards. People watching here from all over the country are now saying, okay, I'm gonna go get help. I'm gonna get help. How do they know, and what do you recommend that they do to make sure it's a decent program?
So one of the unintended consequences of the Affordable Care Act was that it made treatment a lot more accessible than it was. But the unintended consequence is that a lot of people started opening up just because they saw big dollar signs. And when money is the motivating factor in healthcare, you know you're not gonna get the highest quality product. So there are always a couple things that I tell families to look for when choosing a treatment program for their loved one. Number one is how much information is on their website. Is their staff listed by name on their website? Do they have a lot of clinicians and doctors and direct service staff, or is it all marketing staff? Also on their website should be organic, really good content about the natures of addiction, what to look for, and what does recovery look like and how do you get there. The content on their website and when you call these programs should be very comprehensive. The third, and maybe the most important thing, is when you call these programs, make sure you are talking to somebody that is actually at the treatment center and works for the treatment center you are calling. There have been a lot of national helplines come out lately that have used Google to get their name out there that don't actually work for a treatment center or at a treatment center. They are basically just a referral service, and they get paid by the treatment center to send that treatment center patients. And so when you call them, you're not necessarily being directed towards the best fit for your loved one, towards the best treatment, towards the best available option. You are only being sent to the places that are paying that call center. So make sure that you are always talking to somebody that is working at the actual treatment center.
That's a great one, because you do see now every commercial is a 1-800-HELP.
Exactly.
You know, if you have a drug problem, call us. But they're not, like you said, they're not attached to the program. How about certifications? Is this something people should be looking for a program? Are they certified by the state or a bigger organization?
Absolutely. So they have to be certified at the state that they're located in. Every single state has a governing body that governs licenses for treatment centers. On top of that, another thing to really look for is, are they accredited nationally by one of two organizations, CARF or the Joint Commission of Healthcare Organizations. Those two organizations are the best known gold standard of accrediting bodies for drug addiction treatment centers. And so that'll give you an extra layer of protection, an extra layer of comfort when you're looking. If you see the CARF symbol or the Joint Commission symbol on their website, or you could always call them and ask them if they're accredited.
Yeah, that's important. It's something that they can do anywhere. I mean, this is a national certification. It's a national program for them to find out about. When someone makes that first call for their loved one, the evaluation, the assessment is critical, right?
Absolutely. The assessment's very critical. And what you should be looking for when you call for your loved one or your loved one calls themselves is, what kind of questions is the person on the other end of the phone asking? Are they asking about your life, your family life? When did this start? What traumatic events have happened to you? What prior treatments have you had? All that stuff. Are they just asking about the financial portion?
Right.
If they're starting with the financial portion and just asking about that, that is a big red flag to me that they may not be in this for the right reasons.
That's not a good one. There's so much information that we need to get out. You know, we're going to keep doing shows here at Straight Talk about it. We're just going to keep doing them and get as much information as we can. You were terrific. Great information.
Thanks,
I mean, really, I want people to know that this is all over the country. Doesn't matter where you are. You're in Maryland, but I don't care what city you're watching. You've got the same issues, same concerns, and now you're giving them some great tips. So thank you so much.
Thanks, Mike. I appreciate you having me.
Today on Straight Talk, we're trying to educate you about this opiate epidemic. If you know someone or yourself, if you have a problem, pick up the phone, get some help. Do whatever you have to do to get that person help, because that's the only way we're going to beat this problem. I want to thank my guest. Thank you for watching Straight Talk, and we'll see you next time.